health reform advocate and former COVID-19 Task Force Special Advisor, Dr. Tony Leachon. Good morning, Dr. Leachon, and thanks for joining us.
Good morning, Ruth, and good morning to the viewers. Magandang umaga po.
Doctor, with the Omicron variant now being the predominant variant in NCR, there have been calls to further fast-track vaccination. But earlier, we had a report saying a fourth dose of COVID-19 vaccine might not be enough to protect against a possible breakthrough infection caused by Omicron. Can you tell us if you have the same studies, or what are your thoughts on this?
Well, Israel is, of course, the trailblazer for the booster because they're the first country to introduce a third dose, and which triggered the US FDA and the CDC to promote this across the world. And we know that, according to Professor Nina Gloriani, that the first dose can give you 50% protection. Second will give you 70%, and the third dose will give you 90%. And Israel and I think Chile also is the other country that promotes also the fourth dose. But the newer study in Israel showed that the fourth dose may be effective for Alpha and Delta, but not for Omicron. So basically, I think bago pa, it's very difficult to say na effective kagad siya for Omicron. We know it's highly transmissible, and perhaps they need another study to prove this. But let's see. I think this particular variant is actually evasive. I mean, it can actually cause immune escape, which you cannot recognize that particular variant when actually once it has penetrated the body. So more and more studies should be done whether we will need a fourth dose in the future.
Kasi Doc, with the surge we're having now, I would hear some people saying na, oh, kahit naman bakunado or even those who got their booster shots still get infected with Omicron. So how would you address this one, and how would you talk to people lalo na yung ayaw pa rin magpabakuna because of this?
Well, ang essence naman ng pagbabakuna is basically to reduce the number of hospitalization and reduce the number of deaths. We see right now, kahit kunyari the Delta variant and of course the Omicron, we see fewer deaths and hospitalizations with the Omicron at the present time. And even we see also in the Delta variant that we were able to, with the vaccination last September, October, we were able to flatten the curve with the Delta variant, which was at the time the prominent one. Here in the Omicron, that's mild, but as you can see, the healthcare utilization ay hindi pa nga napupuno yung mga ospital. A number of deaths also lower than this one. So I think ang role ng vaccines na gawa naman niya is basically to reduce the number of hospitalization and of course, the number of deaths. So to me, nagawa niya yung role niya. Ang kailangan lang sa atin is of course, to reduce the viral transmission para hindi siya maging disruptive with the economy, knowing that it can cause infection in the family or it can cause clusterings, which may actually be problematic, particularly in areas outside the national capital region with weaker healthcare system than the national capital region.
Doctor, the government has already announced that it will use pharmacies and private clinics as vaccination sites, especially for giving booster shots. I remember that this is already being done in other countries, and you already pointed out before. How do you think this will speed up the country's inoculation program?
I think this is a good move when you involve the private sector and the pharmacies with additional help. I think the Philippine Pharmacists Association is a reputable organization together with the different pharmacies. I think this will fast-track the vaccination nationwide. And the pharmacies may actually be a venue or a place where you can allow a cold chain facilities to be there. And of course, you have trained pharmacies. But I'm waiting for the full approval of at least one particular vaccine, that is Pfizer. In the States, it was given this approval to shift from EUA, emergency use authorization, to full authorization. And this would mean it can be commercialized. Now, if this happens, then the vaccination will not be coming from the National Task Force, but pharmacies and, of course, doctors will be able to purchase that or commercialize that so that the doctors will be able to help address vaccine hesitancy. And, of course, with the presence of the different pharmacies all over the country, like in the States, like Walgreens, CVS,
Yeah.
and other drugstores will be able to help in terms of decongesting super spreader events, yung pwede magkakaroon ng super
Okay.
spreader events in huge vaccination center. At the same time, address the deployment of vaccines in the countryside with problems in cold chain facilities, particularly do sa may Typhoon Odette evacuation center. So sa akin, malaking tulong
Okay.
itong pharmacies.
Huli na lang po, Doc, kasi yesterday we actually saw cases in Metro Manila fall below the 30,000 mark. So we had over 28,000 cases, at least here in nationwide. No? But do you see already, is the peak over in terms of the daily number of cases?
Hindi pa Ruth kasi I'm doing my private practice right now and 80% pa rin of patients. As a cardiologist to see around 80% ng COVID cases, that's huge. Pangalawa, out of stock pa rin ang mga medications eh. And then number three, ang nare-record lang nila dyan sa Department of Health is only the RT-PCR. Wala pa dyan yung rapid antigen test integrated. Plus, marami pa rin tayo na hindi gumagamit ng test at symptom-based na lang kasi mahal ang mga testing. So, ang antaya ko, underreported yung report kahapon na 28,000 tayo kahapon. Well, the projection ng some group, particularly si Professor Joe Marabahante, it could be 6 to 15 times more than the reported case in Department of Health. And I can believe that. Let's say kung 30,000 tayo, 6 times, mga 200,000 siguro to 400,000. Given the number of cases we see right now on the outpatient department or on the telemedicine consult. So I don't think we're reaching right now a peak because it's still being seen in the outpatient. Tsaka pangalawa, it's right on spreading in different areas of the country. And we will see some cases at different stages. Iba pa galing na, iba pa peak. Ang iba sa ngayon, hindi ko pa masasabi. But I know
Okay.
we have that because the vaccination rate natin mababa sa countryside. And then makita mo naman ang positivity rate, mataas pa rin, 43.4%, dapat less than 5%.
Okay.
And our active cases, napakataas at 284,000. So I don't think we're out of the woods at this point in time.
Thank you, Health Reform Advocate Dr. Tony Leachon.